organizer to let me share our investigation in this prestigious conference. This study was undertaken to evaluate the effect of whey protein concentrate on glucose, insulin, C-peptide oral, and intact GLP-1 plasma levels following high glycemic index breakfast in patients with type 2 diabetes. It is known that the earliest changes in developing the type 2 diabetes are deficient and delayed early prandial insulin release and postprandial hyperglycemia in type 2 diabetes. It recently was correlated with increased cardiovascular risk, and postprandial hyperglycemia usually is a limiting factor to achieve adequate glycemic control. It is known that GLP-1 increased the early prandial insulin release as well as decrease the postprandial glucose response. However, we know that in type 2 diabetes, the postprandial total and intact GLP-1 is reduced while the degradation is enhanced. Because then as we can see here, it leads to inappropriate insulin release in type 2 diabetic patients compared to healthy controls. Whey protein, which accounts to 20% of all milk protein, seems to induce insulinotropic beta cell stimulating and glucose lowering effects through specific insulinogenic amino acid and through stimulation of GLP-1 release and DPP-4 inhibitory effect on GLP-1. Our hypothesis, therefore, is that whey protein bioactive peptides, through increasing total and intact GLP-1 and by decreasing their degradation, leads to insulinotropic effects and may cause a glucose-lowering effect in patients with type 2 diabetes. The effects of whey protein on total GLP-1 and intact GLP-1 have not been previously evaluated in type 2 diabetes. The objective, therefore, the aim of our study was to evaluate how whey protein consumed before a high glycemic index breakfast may decrease the postprandial glucose